Hello everyone, Dr. Tenderlee here today. We're talking about tonsillitis, what every parent needs to know. Yeah, so what are the tonsils? The tonsils are like these tissues at the back of your throat. They act like security guards waiting, ready to grab any organism foreign to the body coming in through the portal, especially through the mouth. Yeah, so when they grab these foreign bodies, they swell up, they become red. And then that's what we look out for when we say we want to look at the back of your baby's throat, especially when you come complaining that this baby is refusing feeds, the baby is hot, the baby is drooling saliva, maybe the baby has this bad breath. Yeah, so those are some of the things we know you may complain about. Some even go as far as saying, noticing that their babies who were not snoring before started snoring, especially when asleep. So those are some of the things that will make us think about that. And then when we look in and then see what we need to see there, that the tonsils are big and red, it helps us make that diagnosis. So acute tonsillitis can be caused by viruses and bacteria. Yeah, so viruses are more common. And then when for those ones, there's really nothing much you can do because viral causes of illnesses, they are like self-limiting. Just allow the children rest it out, give them fluids, take care of the temperature, and then with time they'll be fine. But for those caused by bacteria, they will need proper medications, antibiotics prescribed by a pediatrician. So in some cases where they have started snoring, so it just shows that it's now like a very severe form of the tonsillitis, and it's now blocking the airway, so they're not getting in as much air as they should, especially when asleep. And the tongue is also there, adding to that obstruction. And then in such cases, we advise that you see an ear, nose and throat doctor who will ask for an x-ray of the postnasal space, as what we call it. And then depending on what we see, they may ask that a surgery is done, especially when there are other questions they've asked, and then you think that the child has met the criteria for the tonsillectomy. So that's the removal of the tonsils. But it's nothing to be worried about. It's a surgery, and then there's something to know about it. For those who have undergone it, yeah, not like I'm downplaying it, but at the end of the surgery, they ask you to take ice cream. Isn't that fun? But it's okay. There's really nothing to be worried about. The child will be fine. And then, so there's really the good news is that the children will be fine. So I am hoping that, so you've understood a bit what tonsillitis is. And then when next someone needs you to say something about it, at least you can say. Please remember to subscribe, like, and share my video. You have a great day. Dr. Tenderlee here, touching lives with Tenderlee.